This our capstone project essay, part 3, and my partner is Maya Fick. So we decided to put in interventions and nursing diagnosis as nurses, we always come up with a nursing diagnosis included with interventions that is appropriate for patients who are liver cancer. And our top 3 nursing diagnoses for patients who have liver cancers is as follows. Risk for bleeding as related to altered clotting factors, lack of production of fibrinogen. I decided to put risk for bleeding because people with liver cancer may have altered bleeding, risk for bleeding, and altered clotting factors. And our liver is responsible for producing most of these coagulation factors. And it does help promote blood clot formation. So it's important for patients who has risk for bleeding, make sure that to stay off from aspirin related products, as it may be a risk for hemorrhage. And we want to encourage the patient to use soft toothbrushes or an electric razor, because you remember when some patients brush their teeth and there may be bleeding between the gums, and we want to watch out for that, especially with razors. Some patients use a cheap razors and may have some cuts on it, may cause bleeding. And yeah, so for our next diagnosis is risk for impaired skin integrity as related to altered circulation, presence of edema, acids, pruritus or itchy skin, and poor skin turgor. And it's best to encourage patient to reposition every 2 hours. It helps promote circulations and help decrease the chance of skin breakdown. And we want to encourage patients to not scratch their skin, because patients with pruritus or yellowing skin have tendency of want to scratch their skin. And to the point, patient kept on scratching the skin, causing risk for bruising and bleeding. We want to encourage patients to perform active or passive range of motion exercises, as it also promotes blood circulation. And my last nursing diagnosis is fatigue related to altered body chemistry caused by liver cancer, as evidenced by side effects of medications and chemotherapy. So most liver cancer patients often go into a chemotherapy regimen and other medications that could contribute to fatigue. But let alone without the medication or chemotherapy, liver cancer also cause fatigue due to poor circulations. And it's best to encourage patients to try to relax and teach them some relaxation techniques, as stress can worsen the condition. We want to allow patients to have frequent rest periods. It is needed to conserve energy. And that is all.